Happy good afternoon to everybody. It's raining here in Manila, same place where Dodo is.
Hello, good afternoon. Some familiar faces, right?
And hi, Ako.
Good afternoon.
How are you, Randy?
I'm good, happy,
Happy?
happy that we have our first webinar. Excited to hear from our resource speakers.
Yeah,
Okay,
so am I. Go ahead, Randy.
okay, so let's start. Good afternoon again. Sawadee Kap. So to provide us an overview of the Secure Webinar series and what Technical Assistance 6767 is all about, is a champion of universal health coverage. He used to be the CEO of the Philippine Health Insurance Corporation, or PhilHealth. And before working with ABB, he has worked with WHO and the World Bank. Now he's the principal health specialist of the Southeast Asia Regional Department in the ADB. I'd like you all to welcome Dr. Edward Dodo Banzon. Hi, Dodo.
Hi.
Your turn.
Thanks, Randy. And can we have the next slide, please? Sorry. So we probably so what we were so the security is a 5 million technical assistance facility of Southeast Asia. SAHS. Okay, and it's designed to help prepare uh, and implement projects supporting COVID vaccination rollout and expansion in Southeast Asia. So in the different developing member countries in South Asia, it is going to support not just, of course, the implementation of projects of the AFVAX facility, which is helping, of course, our DMCs procure vaccines, but would also make sure that our countries, our DMCs, are prepared for any future disease outbreaks and pandemics. Next slide, please. So, as a TA, can we have next slide? Hello. Next slide, please. Sorry. Do I have control? Okay. So, as can we go back? Can we go back one more? So primarily, of course, it will make sure. So we know that with COVID-19, ADB responding by supporting our developing member countries, not just in Southeast Asia but in the rest of Asia Pacific. With the first wave was a 20 billion facility that was helping countries respond immediately to the not just the health impact but also the economic impact of the pandemic. Then this was followed by the 9 billion facility, which we called AFAX, which is helping our countries rapidly procure and deliver and deploy COVID-19 vaccines. Next slide. So in Southeast Asia, we have about four AFAX projects in 3 countries. So in the Philippines, we have started with uh, we have what we call the Heal 2 project, and that has basically funded about 85 million doses. So it's done with the co-financing with AIB, and for a while, it was funding up to 50 to 60% of the vaccines that was available in the country. This was then followed by additional financing, which we call the Heal 2. And this will be funding or in the process of funding the procurement of pediatric doses of COVID-19 vaccines and booster vaccines. In Indonesia, we have what we call Recover, and then finally in Cambodia, what we call CRIS. So these AFVAX projects are helping our DMCs make sure that they have enough COVID-19 vaccines in other countries which do not have projects. This facility, the secure facility, could also still help these countries make sure uh, continue to consider exploring ADB support for accessing, for procuring and delivering COVID-19 vaccines. Next slide, please. So the TA looks into supporting logistics management, strengthening regulatory, supporting the countries to set up contingency plans, particularly with the mutant and the variants that are coming in, with this is a pandemic that it seems that every month there's new thinking, new discussion, even with the way the vaccines policies are seems to be changing. So we will help our DMCs also respond to the rapidly changing environment that the pandemic is. Next slide, please. It will also help investments in vaccine information system, work closely with existing, for example, ASEAN or the GMS, the Greater Mekong, to so that we could strengthen collaboration among countries for regional health security, and most importantly, facilitate sharing of best practices, which we are starting to do right now. Next slide. It will also support partnerships with the private sector and CSOs. That's why one of our presentations here is such a partnership that's happening in the Philippines. Then help mobilize resources for national vaccine strategies while ensuring, of course, that gender responsive. Next slide, please. Okay. Uh, so that the specific TA outputs, one is we are going to help our DMCs in Southeast Asia develop new AFAX projects and post COVID-19 health security projects. The second output is to help implement this, and the third output is to help document, develop, disseminate, promote best practices. Next slide. So this is being administered, as we said, by the Human and Social Development Division of Southeast Asia. And this webinar is the start of what we would expect a whole series of webinars where we will help document and present and disseminate best practices in Southeast on COVID-19 vaccination and health security in Southeast Asia. Over to you, Randy.
Thank you, Dodo. Hold on. Thank you, Dodo. There will be more webinar series, as Dodo said. This is just the first. And to welcome us to the first secure webinar is the director of the Southeast Asia Department, Human and Social Development Division at the ADB. She leads the planning and implementation of ADB's lending and non-lending operations in the social sectors. That includes education, skills development, health, and social protection. She is also the chair of ADB's health sector group and a staunch supporter of regional health cooperation. She provided the push for the creation of the Greater Mekong Sub-Region Working Group on Health Cooperation, a platform for the 6 Mekong countries working together on health. And I'm very proud to present to you Ms. Ayako Inagaki.
Yes, thank you. Thank you very much, Randy. And first of all, warm welcome to all participants of this secure web seminars. You know, I'm so excited that we are finally able to deliver this first seminar. You know, last year when we got to know that there are some technical assistance available that are specific to COVID-19 and COVID-19 vaccine and vaccination, we jump on it, and we wanted really to get this TA that will be really a very important element of this TA is to share lessons from countries, rich lessons, I must say, because of the journeys that countries have gone through from, you know, supply of vaccines to the initial rolling out till, you know, now we are going into perhaps, you know, a transition into how to make this COVID-19 vaccination more a sustainable one. So it has been a long journey, and unfortunately the journey hasn't ended yet, right? So I think it's very, very important for all of us to share lessons and to think about the future, not the future of COVID-19, the future of you know, how health security will be even a more important agenda in the region. So that's why I'm really happy that we're able to launch this secure webinar series. As I said, it has been a long journey. I think now, after the initial, struggling for countries to secure safe and, efficacious vaccines, now countries were able to, I think, in average in the world, about more than 55% of the populations have been vaccinated. So it's a good progress. A lot of strugglings that happen. So that's one, let's say, milestone that the world has achieved. Now, many issues, right, on the equity of access. Some populations are obviously hesitant to take vaccines. A lot of health workers have been struggling also to get a proper maybe training and to have been organized to provide this efficient vaccination rolled out. So monitoring and of the effect of the vaccine has been also a very important issues for everyone. So in this long journey, I'm not so sure how you feel where we are. In my view, after a relatively, well, let's say on average, successful initial rollout, now a lot of countries are doing boosters, a vaccine for the children. Perhaps one of the challenges here is how to reach what I would call the last mile populations, right? The percentage that are still not being vaccinated, whether they don't know about it, they really do not want to. Anyway, that remains unprotected. And the next is really how you want to integrate this COVID-19 vaccination perhaps into some of the countries are really thinking about integrating into the routine immunization process, making the entire vaccination to be a sustainable one. And the other thing is really how some countries will be able to produce and manufacture their own vaccine also with the assumption that COVID-19 may end one day, but perhaps maybe a new pandemic. We have to prepare ourselves for the new pandemic. So I look forward to the discussions. A lot of innovative approaches will be presented on the use of mobile application, on vaccine development, manufacturing, the engagement of private sector, and the use of digital technology, digital information system. It's not only about the use of technology, right? There are many other ways to bring innovation into the vaccination process. A whole of government approach, whole of society approach. It's all, I think, what we want to learn from each other. So now, over to you, Randy. I think we should, as soon as possible, get into the heart of the discussion. So welcome, everyone, and I really look forward to the discussions.
Thank you so much, Ayako, and nice seeing you again. Today we have lined up, as Ayako mentioned, very exciting topics, and this is just to jumpstart the webinar series. So without much ado, let's go on to the first topic. Our next speaker is Ms. Rabia Al-Adawiya. She's a medical doctor whose expertise include health economics and health policy, which is why she's currently working on her PhD on health economics and policy. Dr. Rabia is currently the health security consultant for Indonesia under the TA 6767. So, Rabia?
Thank you, Randy, for the introduction. Can you see my screen?
Okay, there.
Yes.
Okay. Yep.
Thank you. Good afternoon, everyone, and thank you so much for Randy for introduction. And I'm really excited to be given the opportunity to present in today's webinar. And today I will present on the SMILE system, which is the logistic electronic monitoring system that has been used for strengthening vaccination supply chain system, especially during the COVID-19 pandemic in Indonesia. During the presentation, I will go through some important context and the challenges of the cold chain supply in Indonesia, then the description of the SMILE system, their interface and technical usage and their distribution pathway. I will also go through some of the SMILE key progress, some challenges, enablers and barriers for the implementation, and key message to conclude my presentations. So this is the map of Indonesia with population density of people per kilometer square. As you all can see here, more than 60% of Indonesia population are densely concentrated in Java, Bali Island, while the rest of 40% are scattered across the archipelago. Indonesia have an estimate of 5.3 million pregnancy annually, and Indonesia also have 23.9 million children under 5. Indonesia public healthcare system is heavily supported by 10,000 public primary care facility, or later on we will call it as a puskesmas around the country. In Indonesia, challenges on cold chain supply are on the real-time monitoring of stocks and storage temperature. As also you can see through the map, Indonesia has difficult geography and a natural disaster-prone area. There is an existing, incomplete, and unstandardized documentation system, especially in health sector, and there is lack of data in the actual vaccine consumption. A little bit of COVID situation currently in Indonesia. Per 21st of February 2022, there are around 5,232,000 total cases and 34,000 daily new cases recorded with around 240,000 daily tests. There were 176 daily new COVID-19 deaths, and in the week of 7 to 13 February, 30 out of 34 provinces experienced an increase of 100% or more of new COVID-19 cases. For the vaccinations progress, out of 208 million people that targeted, 91% have received their first dose, 91 have received their first dose, while 67 and 4 have received the second and third dose respectively. Nationwide, around 40 per 100 total population of older people have been fully vaccinated per 16th of February. Now we'll go through the SMILE itself. SMILE is a technological solution that's been developed to strengthen the existing immunization or vaccination supply chain system in Indonesia. With key feature is its ability to enable real-time visibility of vaccine cold chain logistic and digitizing stock supply and storage temperatures across vaccine cold chain points. The SMILE application was initially piloted in 2018 to support national immunization program and was piloted in 54 public primary care in 2 districts in Indonesia. So initially the scaling up plan will be stepwise from 2020 to 2025. However, the unprecedented event of COVID-19 pandemic has accelerated the scaling up of the implementation for the SMILE application. And currently they are running 2 different systems. One is for COVID-19 vaccinations and one for the national immunization program. This is the way how the SMILE application work. The distribution from Biopharma warehouse. Biopharma is the state-owned enterprise responsible for vaccine production and packaging to the provincial vaccine warehouse is track-use Biopharma application system, while the distribution from provincial warehouse to puskesmas are using SMILE application. Here I have to note that puskesmas is the main user of SMILE application and one of the important actors in vaccine distribution. The distribution to hospital, even for central government or vertical hospital and provincial hospital and private clinic, have to go through puskesmas. The key feature of SMILE application include 4 things. The first is the phone application. The healthcare staff in primary public care can log in and order vaccination related supply through the phone apps. They also provide an inventory dashboard where healthcare staff can check the inventory of vaccine supply and its expiry date, as well as the temperature. While the website portal, by accessing the portal, we have access to the dashboard of vaccination supply inventory, temperature, the form of order and request. We also could check reports, table, and summary analysis that can be filtered and sorted by specific period of time. A new feature just added to the website portal, such as location monitoring for delivery with GPS technology, QR code per vial deliver, measurement of cold chain capacity, and ability to do planning and budgeting in the website portal. The Smile app also have temperature sensor with GPS, where each of storage of vaccine with exact location and real-time data collection that is updated every 10 to 15 minutes directly to the inventory dashboard. This lessens the need to open and close fridge or freezer where vaccine is stored that actually will damaging the quality of vaccine inside. They also have vial information that have batch and serial number to simplify the tracking and tracing system. Currently, the smallest unit of identification for vial is in the batch of production that can trace a pack of hundreds and thousand vials. Slide, there is a clearer distribution pathway of vaccine from Ministry of Health to the vaccine delivery point. Here we can see that Puskesmas is hold an important role for the inventory, request for stock, booking management, and their important role in distributing vaccine to each of vaccine delivery point that could include hospital, private practice, or midwife clinic. Since the Smile pilot location in 2018 that covered 2 districts, in 2021, Smile has been used in 18 provinces and currently is targeting to reach 10,000 public primary healthcare in all Indonesia, Puskes in all 514 districts and 34 provinces nationwide for the COVID vaccination, and also targeting 2,000 Puskesmas to be reached for overall national immunization program called cold chain supply by the end of this year. I will go through the challenges of the implementation. So initially, the challenges in the implementation of Smile application was coming from policymaker and stakeholder with their skepticisms, especially in the beginning when the cold chain supply management for immunization had been dominantly manual-based documentation system. There was also hesitancy from stakeholder due to the assumed lack of technological skill that healthcare workers have and their compliance and adherence to the daily data entry. There was also a classic internet and mobile signal stability has been quote from our resource at the health facility, and also glitches problem with other applications. As I've been explained before, that there is a biopharma application system that also has to be integrated with the Smile application, and there are glitches in the beginning, but the problem has been solved currently. But this is also a potential future problem if between application data need to be integrated. Successful of implementation and scaling up of the Smile application is the strong political willingness and support that were given from the top stakeholder, such as from Minister of Health and Coordinating Minister of Economic Affairs and Minister of Health, especially after the real need of a digital and real-time cold chain supply for reaching the target of national COVID-19 vaccination program. Support also given from the Directorate of Pharma and Medical Devices in Ministry of Health, because the Smile application has enabled the better accountability and documentation system for vaccine and its related supply. UNDP is the one who responsible for the Smile application, is also an experienced implementer, especially in the sector of immunization program. UNDP have a long experience in the routine immunization program, and they have a business model that proven to work even in the routine immunization program that are actually more complex than the supply chain for COVID-19. So in the initial implementation, they have managed to do the campaign and socialization of the Smile apps to make sure that healthcare staff can use the apps for 10,000 facilities just within the 3 weeks since the launch of the apps. So the key messages that I would like to conclude the presentation today, the COVID-19 pandemic has actually accelerated the progress and scaling up implementation of Smile program that intended to scale up by 2025. and the importance of strong political willingness in the introduction of new health solution or new health innovation, and the solution that being offered should match the existing needs of problem in the field to ensure the successful implementation of the program. So thank you so much for listening, and I return it back to you, Randy. Thank you.
Terima kasih. Yeah. If there will be questions later on, you can raise your hand during the Q&A or put your questions in the chat box. Before we go to the next speaker, I'd just like to tell you guys that after each webinar series, we'll be compiling policy briefs or webinar briefs, hopefully for all the webinar series that we will be holding. So we have something very tangible out of these webinars. Next, we go to the next speaker, and this time he's also a medical doctor who will speak on the need for interoperable vaccine-related information system, Dr. Raymond Francis R. Sarmiento. One trivia is that he speaks 5 languages: Italian, Spanish, Japanese, Filipino, and English, and currently the director of the National Telehealth Center, National Institute of Health at the University of the Philippines. Under TA 6767, Dr. Raymond is our digital health expert. Raymond, your turn.
Thank you so much, Randy. We have been trying to work on many different things with regards to interoperability of vaccine-related information systems. I'm trying to show onto my screen. Are you able to see my screen now?
Not yet.
Not yet. Okay.
Okay, there you go.
Okay, I'll just go to slideshow, and I hope that's something that can be seen by all. Just a general disclaimer that all statements issued are mine alone, and my presentation does not necessarily reflect the position of the university or the Philippine government. I also declare no conflicts of interest with any proprietary entities I may mention, and no financial relationships with any of the proprietary products or services I may mention also. These are my competing interests for this presentation. My use case will be obviously focusing on the Philippines, how the vaccine information management system has been used to enable the COVID-19 vaccination journey. We were able early on to identify the different processes from end to end, starting with the master
Excuse me,
listing.
Dr. Sarmiento. I'm so sorry
Yes.
to disturb your presentation, but we can't see your screen. It only says loading once
Okay.
you put it on
On
full
slideshow.
screen. Yeah.
Okay. Let me hold on. I think I may be able to do this if how about now?
There you go. Thank you.
Okay. Thank you. So as I was saying, we started with identifying the business processes from end to end, starting with the master listing and identification of the inventory and supply chain, how the vaccines were to be administered, the uploading on a nearly daily basis of the vaccination line lists, and then the digital vaccination certificate. What will be important to note is that the Philippines has never attempted something of this magnitude with regards to any digital health or health information system that would be implemented for millions of Filipinos in just a very short span of time. So this was a monumental effort and that required the government, partners from the private sector, as well from non-government organizations and civil society organizations to make sure that the vaccine information management system is rolled out with less hiccups as possible. Support activities were as follows: training, contact center, and regional support, data management coming in from local, regional, and national. And that required also data quality checks at all levels, that will be at the local, regional, and national levels to make sure that all of the data that gets reported to the National Vaccination Operations Center through its national dashboard reflects up-to-date data just because we have daily meetings that will require where the vaccines will be best funneled or distributed given the short number of vaccines available early on during the rollout. The dashboard and the reporting were very, very crucial, as well as the governance and operations aspect of the health information system. We tied all of it together in this VIMS ecosystem just because it played a role in terms of being able to identify which stakeholders from government that were involved, such as the Department of Information and Communications Technology, the Department of Health, the Food and Drug Administration, and other third-party providers who were really performing critical tasks to be able to make sure that all of the data gets passed on to the different end products. You will note that the local government units, that's what LGU stands for, had their own systems in place also. What was critical was to be able to centralize all of that data into respective repositories based on the business processes that were identified. So there was one for master listing, there was one for supply chain, one for the vaccine administration also. The data warehouse is where all of these get consolidated, and if there was any data that needs to be reported through the dashboard or through the digital vaccination certificate, or if there were any event-based surveillance systems or adverse events following immunizations using the VGFlow systems, those are the ones that get extracted from the data warehouse that consolidates the data. This is a snapshot of what we have in terms of vaccination coverage dashboard. As mentioned, this gets updated on a daily basis to be able to identify which areas in the Philippines would require more distribution of the vaccines. On the upper right side, you will note that the total figures are noted, and the region which represents that part of the dashboard is also indicated. It's color coordinated in the sense that the codes reflect if that particular area, municipality, city, or region has reached the target, or it's 50 to 90%, 99% only, or less than 50%. What you will note is that this dashboard is divided into two. The ones that were from the last 3 days and the total targets on this side. And then on the other side is the computed ending inventory and the alert level in terms of the usage for that. Very important to note that days to last indicates how many remaining inventory is still there in the warehouses, the physical warehouses of the Department of Health, and also the 3PLs, or the third-party logistics providers. If you are green, that means you are near the complete consumption of the vaccines, and you only have X number of days to be able to consume them. If you were a local government unit, it was important that you were not in the red zone, because that means there were stocks or inventories that remained in the warehouses unutilized, and that's something that's not good, especially with the importance of the vaccines and the expiry dates of those vaccines that were in the warehouses. Vaccine inventory and supply chain management system is the one that gets filled out at the local and then the regional level to be able to indicate the beginning inventory and the ending inventory each and every day for the vaccines for that particular region, for a particular brand on that particular date. And it also indicates how many first doses and second doses of that brand has been administered to date. Next is the vaccination line list submission. There have been several in the thousands in terms of the local government units and vaccination sites, the official vaccination sites that have been using the DICT Vaccine Administration System, or DVAS, which essentially automates all of the process from registration all the way to the uploading of the vaccination line list at the end of the day. One of the challenges was that even though the government was providing this for free, there were certain local government units and vaccination sites that already had pre-purchased or planned already and therefore subsequently purchase their own systems. So interoperability and integration of all of those data contained in those silo systems was critical to be addressed immediately. The LGU impact in terms of having an automated system was a shortened vaccination time based on the person's journey or vaccinee journey by at the very least decreasing or reducing the number of minutes by 50% for that particular journey from end to end. The accuracy of data is very high because it reduces the spelling and detailed errors, and it already incorporates the official template that's required and the official data elements that's required by the national government. Faster reporting, which usually takes on the usual 3 hours at the end of the day after they had conducted their own vaccination to a little less than 30 to 40 minutes to be able to make sure that all of the data gets submitted, and the minimization of the errors and lessening of physical data. And this is based on the time and motion study that was conducted in one of the local government units in the National Capital Region. Finally, we have the digital vaccination certificate, which had a very, very short turnaround time with regards to the development, the testing, and the public launch. On the left-hand side, you will see a sample of the VaxCert PH with the vaccine details, the secured QR code that's generated that can only be read by the QR code reader in vaccert.doh.gov.ph, and all of the certificate data and also the data for that particular vaccinee with regards to the date of vaccinations done, which now includes the boosters, the brand, the manufacturer, and the batch number. Very, very important to note that we were able to map this to the WHO's digital documentation for COVID-19 certification early on. And very important to note also that this is what has been the standard in terms of being able to test out the mutual recognition of digital vaccination certificates across the borders. So far, as of February 21 or as of today, there are 49 countries that the Philippines has established mutual recognition all around the world. There were an additional 8 countries that were added over the weekend, and that brought the total number of countries to 49. The Department of Foreign Affairs is looking forward to increasing the number of countries that which the Philippines have entered into mutual recognition very soon, and hopefully that will be within the next month. The EU digital documentation for COVID-19 certification, the testing out for that should be completed, and that would mean that any Filipino who has been vaccinated, or anyone who has been vaccinated here in the Philippines and who will want to travel to any member country of the European Union will just need to show their VaxCert PH, and that will be recognized for whether they enter the country or they enter the mall in some member country in the EU. That will be what will be recognized in those other countries. So just to finish and in summary, very important to be able to identify that even though there were multiple health information systems in place, whether it was by the government, it was procured through a third-party provider, it was developed natively by the local government units. Very important to note that governance and the operations played a critical part to be able to make sure that all of the data gets centralized. We continue to support the Philippine government in terms of being able to consolidate all of the data in the VIMS data warehouse, and to make sure that all of the data is not just reflected accurately but completely as well. Thank you, and that's the end of my presentation.
Thank you, Raymond. Very interesting presentation. I think there will be questions, a lot of questions later on when we discuss the digital vaccine certificate that's mutually recognized. I'm sure a lot of other countries, we have Laos here and Thailand, and I think Vietnam, who would be very interested to find out more about the vaccine, digital vaccine certificate. So we go now to the next presentation. Um, Ms. Jeremy Goraspe is a pharmacist who has worked with various development partners, including WHO and the ADBs, and in the ADB, and she has obtained her master's in public health for development in London School of Hygiene and Tropical Medicine. And Jem has excellent grasp of COVID-19 and vaccine issues in the Philippines. She is our health security expert under TA 6767. Go ahead, Jem. You are on mute.
Thank you, Randy.
Okay.
Let's just reshare again. Yeah. I'm going to I'm going to talk about the public-private sector partnership and the national COVID-19 vaccination program in the Philippines. Just a disclaimer: all the photos used here in the presentation are shared by the private sector. So the consortium of the private sector, called T3, or the Task Force Test, Treat, and Treat, actually started early April 2020, when the government asked private sectors, including the conglomerates, to help the country increase the testing capacity. So they were able to increase the testing capacity from around 30,000 to, we can now do 90,000 tests a day. This is RT-PCR tests. The name was coined together with the government when they were trying to think of how to call the group. So the objective is to restart the Philippine economy and to build consumer confidence. These are the members of the E3 private the consortium. This the participants have well expanded. So this is just the first few who started the consortium. The initial work stream of the T3 was to do licensing, personal protective equipment, One Health Command hospital, also isolation facility, to build up testing booths, and now they've moved on to also help the government with a vaccine roadmap. So some of the programs that they've done before have already been passed on to the government to continue. And the vaccine roadmap started with the private sector around August of 2020. And then these are the one of the involvement of the private sector is actually strategic planning and the tripartite agreement, which we believe is unique with the Philippines. So the tripartite agreement started when one of the conglomerates asked if they can help the government or if they can buy vaccines for their employees. And then they started asking the government if this is possible. So Ayala Health, one of the conglomerates helping the government with strategic planning and purchasing and putting up together the vaccine portfolio, actually helped try to help with this with vaccine manufacturers. So they also help build up the vaccine portfolio of the Philippines and help connect the government with the vaccine manufacturers. So currently we have 7 vaccine platforms in the Philippines. It's one of the countries who's using the many forms of vaccines, because other countries usually use just 1 or 2 brands, 3. I think we are one of the countries who's using 7 vaccine platforms. One of the helps of or part of the help of the private sector is operational planning, which is to set target, identify resources, cold chain storage, logistics, and human resources. So one of the main help of the operational planning is the supply, demand, and throughput. One of the significant help that this did is when we were starting the vaccination program in the National Capital Region. The National Capital Region at that time were just producing around 30 jobs per day on a good day. But when they started doing this Manana Matrix, it was called as Manana Matrix because of um, the matrix shared by the private sector actually, is that we started seeing, just a few days after, we started seeing an increase of jobs from around 30,000 to 100,000, and then after a week we're jobbing 150,000 a week. And they also help put together the certain needs like the HR, the syringe, the vaccination sites that were identified. And on the National Vaccination Day, they also help a lot that we were able to do 2.7 million jobs in a single day. And the 3-day national vaccination, the first National Vaccination Day, the 3-day accomplishment was around 8 million jobs for those 3 days. On the communication side, this is where a lot of other private sectors as well was able to join in. So what they offer is strong communication orientation, social listening, creative, analytics, marketing strategy, process orientation, and they were also able to share the best practices playbook. So the communications are help the government translate policies into a more understandable messaging so that even the lay people can understand what the government policies is trying to say regarding the vaccination program. They also help build confidence with the vaccination program. And we all know that there's high hesitancy in the COVID-19 vaccination at the start, and we were able to bring it down to around 10 to 14% nationwide at this time. They also help sustain the momentum by promoting this vacuna benefits. So they work hand in hand with the government. The Department of Health, the Department of Health's brand is Res Vacuna, while the private sector's brand is the Ingat Angat. But they made sure that they work together, and it's accordance to what the government is implementing. So one of the main things that help generate vaccination per day is the vacuna benefits. At the start, it is the discounts that you get in restaurants or other perks, and then they also help with or further on was you can also use shopping discounts. So at a certain time. And while the government used a raffle draw for people who registered and got their vaccines during the first few months of the vaccination program. And this is also where the inclusivity of the private sector came in, because even the small businesses are able to join. All of their materials were shared freely on all the businesses, even the private sector, the Resto PH, which is a group of smaller restaurant chains. They can join. They can use the marketing materials, and then they can also provide their own vaccines or freebies when people eat on their restaurants. So the cold chain storage, cold storage supply, logistics, and administration was also something that the government asked the private sector to help, because they were admittedly do not have the capacity to provide the cold chain storage that the 7 vaccine platform needs, from negative ultra cold chain to 2 to 8 degree Celsius vaccines. So they help augment that. They also help the government in managing different storage and handling conditions, from the storing to throwing to administration. they help set up vaccination sites in different regions in the country, especially working on uh, uh, regions with high population. The HR capacity, so one of the conglomerates actually, they closed some of their operations, their clinics, to help with the vaccination of the government. And they also invent some or help the government with deploying their HR to other regions, and they also try to do the vaccine express. They try to invent a new mechanism of how to make everything accessible to everyone. The supply chain and logistics expertise were also provided. ADB is part of this. ADB actually hired supply chain experts, and we have three logistics consultants helping the government right now. So they do gap analysis, they do root cause analysis with the government, because there has been and admittedly on meetings, the government also mentioned that they are also not logisticians. So the help that ADB and in the private sector was giving regarding supply chain and logistics was a big help. We are now helping, or we are now really meeting with DOH almost every day regarding supply chain and logistics. So another part of the public-private sector partnership was the Angat Buhay um, organization, which is working directly with the Office of the Vice President. They also provided a lot of help from the start of the pandemic, starting from free transportation for essential workers. As mentioned earlier, um, during the start of the pandemic, there was no public transport, so the essential workers doesn't have the means to go to their work. And then this is where the Angat Buhay program came in partnership with the OBP, and then they later on transferred this to the Department of Transportation. So they also provide pre-COVID testing, Bayanihan e-consulta, and then of course the Vaccine Express. So one of the projects that they did was to help ramp up the vaccination. Their Vaccine Express is always working together with the local government unit. So the picture here is the National Vaccination Express in the Manila LGU. This is working together with the LGU. The vaccine came from the LGU supply, and then they match it with their current donors. So in this one, their donor is the sea oil. So they provided the 500 peso gas voucher to all who registered. And on other instances, when they go to the provinces, they incentivize vaccinees to uh, with uh, with grocery packages, and at some point, their private sector partners also provided grocery vouchers. So one of the things that they say this is also effective is that a lot of people, especially from the lower income levels, they can't be absent at work even for half a day, or sometimes it takes a whole day to get vaccinated. So they're always thinking about what they'll lose when they go to the vaccination site. So it's incentivizing them by providing this, like even just something that they will need for a day helps generate more or encourage more vaccinees to come to the day. So that ends my presentation. Thank you.
Thank you, Jem. I've been you can put on your questions at the chat box. I've been receiving questions on my messenger, especially on private sector engagement. So there'll be a lot of discussions later on with you, Jem, on private sector engagement and how to engage with them. So again, colleagues, I'd like you to put in your questions at the chat box, or later on raise your hands when we get to the plenary session. Okay, so thanks again, Jem. Now, another speaker is someone I've worked with since 2020 as part of ADB's support for COVID management in Thailand. Dr. Kanchit Limkan Janarat, or Dr. Kanchit, or sometimes you just call him KL. Uh, got his medicine in degree in Chulalongkorn University, master's also in public health at the Emory University in Atlanta. He has worked with the Thai Ministry of Public Health, had long stint with WHO and the coordinator of the Global Health Security Agenda Regional Coordinating Office in Thailand, and sits at the board of the National Vaccine Institute. Dr. Kanchit is currently our health security expert for Thailand under 6767. Dr. Kanchit, it's your turn.
Thank you very much, Randy, and good afternoon to all participants. My presentation today is about COVID-19 vaccine development in Thailand. I also would like to present a major collaboration on vaccine in ASEAN, entitled ASEAN Vaccine Security and Self-Reliance, or AVSSR. I would like to thank the National Vaccine Institute of Thailand who share the information in this presentation. Next slide. Vaccine development may have to start with the blueprint. Access to COVID-19 vaccine, which contain the national strategy. The vision in this blueprint is that Thai people have equitable and fair access to high quality, safe and effective COVID-19 vaccine to reduce losses of lives and ease the socio-economic impacts. The blueprint has the following objectives. First, it serves as coordination framework for all sector collaboration. Second, to reduce vaccine development cycle time. And third is to build country capacity in the long term. This blueprint was approved by the National Vaccine Committee in April 2020, not long from the report of the first case of COVID-19 in Thailand. Next slide. The implementation of the blueprint has three pathways for implementation. First and foremost is the country research and development. On various vaccine platforms, Thailand has about 20 vaccine candidates in development process. The first candidate entered into the clinical trial process since May 2021, which was a mRNA vaccine candidate developed by Chulalongkorn University. The second pathway is advanced market commitment. Thailand has had access toward various vaccine manufacturers. We expected and achieved to reach 100 million doses target in 2021, and we have reached the target. And we plan for another 150 million more doses for 2022 through the bilateral and multilateral access agreements. The third pathway is the technology transfer. It is one of the most achievable scheme in order to earn the vaccines during this year. The agreement was done between UK AstraZeneca and SAM Bioscience Company. Next slide. Under vaccine development R&D, there are various research institutes, both public and private sectors, join in the vaccine development in various platforms. To name a few, messenger RNA vaccine is Chulalongkorn University in collaboration with University of Pennsylvania. DNA vaccine is Bionet Asia Company. Protein subunit is developed by Bayer Phytopharm and Mahidol University as the example. On the development side, the vaccine production cycle was jigsaw the infrastructure development supported and coordinated by National Vaccine Institute. From a vaccine candidate in laboratory scale to immunogenicity test, safety and efficacy study in animal models, to clinical trial phase 1, 2, and 3 until the licensing of the products. Next slide. These vaccine candidates from previous slide that progress to clinical trials composed of the first one, NDV Hexapro S vaccine, developed by the Government Pharmaceutical Organization or GPO. It is an inactivated egg-based viral vector vaccine, which is a technology that they use to produce influenza vaccine. It is a collaboration with the USA and three vaccine manufacturers in Brazil, Vietnam, and Thailand. It is prepared to enter phase 3 clinical trial very soon. The second one that I would like to mention is Julah-CoV-19 vaccine by Chulalongkorn University Vaccine Research Center. Is messenger RNA, which is about to finish phase 2 clinical trials. The third one, Covigen, which is a DNA vaccine by a private company called Bionet Asia, has finished animal testing, both ID and IM, and they are preparing for phase 1 clinical trial. And the fourth vaccine is vaccine developed by tobacco leaves or plant-based subunit protein vaccine. It is prepared to go for phase 1 clinical trial. Next slide. For infrastructure development, Thailand has two main facilities for fill and finish. The first company, GPO MBP, is a private sector with a capacity of 15 million vials per year, and GPO is public with capacity of about 10 million doses per year. For pilot plant capacity, National Biopharmaceutical Facility, or NBF, is our first state-owned contract manufacturing facility for production of clinical research grade biopharmaceuticals. During the emergence of COVID-19 pandemic, NBF is preparing to be pilot plant for vaccine produced with viral vector and other platforms except inactivated vaccine. Next slide. Thailand has signed an agreement to collaborate with AstraZeneca UK to obtain technology transfer of production with SAM Bioscience company in Thailand. The technology transfer is for viral vector vaccine production. The Ministry of Public Health, SAM Bioscience, CSCG, which is a private foundation, and AstraZeneca has joined forces on COVID-19 vaccine manufacturing for Thailand and Southeast Asia. Next slide. The plan for national vaccine procurement will be as shown in this diagram. In 2021, total vaccine through advanced market commitment or bilateral agreement were 111 million doses. Of these, 61 million were AstraZeneca vaccine, 30 million were Pfizer, and 20 million were Sinovac. In 2022, the agreement planned for 120 million doses. Of these, 60 million will be AstraZeneca, 30 million will be Pfizer, and 30 million will be subunit protein vaccine. Next slide. Through national funding system for National Research Council of Thailand and National Vaccine Institute, potential researchers were identified to produce vaccine in various platforms. And we'll go through animal testing, pilot scale production, and enter into clinical trials and industrial scale production. Another track in parallel is to international collaboration for these for those three pathways that described earlier. Next slide. I would like to present a few slides on this important issue on AVSSR, which National Vaccine Institute Thailand serve as the focal point. Next slide. The AVSSR was adopted by the ASEAN leaders on 2nd November 2019 at the 35th ASEAN Summit in Bangkok. The 5-year strategic and action plan from 2021 to 2025 was endorsed by SOM HD on October 2020 and adopted by AHMM in May 2021. Next slide. The 5 strategies of AVSSR are: first, advance AVSSR into the global policy level in order to be a part of global efforts. Second, support effective procurement strategies and establish regional stockpiling mechanism for both emergency use and routine immunization. Third, to establish or strengthen information sharing platforms to support AVSSR. Fourth, to strengthen capacity of key stakeholders to achieve vaccine security in ASEAN. And lastly, to establish M&E mechanism, including communication and coordination for implementation of the plan. Next slide. So in conclusion, my presentation presented progress made thus far in Thailand in the hope that we can establish a successful partnership for vaccine access and security in Thailand and also in the region. We also call for collaboration which aims to strengthen vaccine capacity. We also in the view that capacity building is a key success for pandemic preparedness, national security, and self-reliance. Next slide. So with that conclusion, thank you very much for your attention. I give the floor back to Randy, please. Thank you.
Kap Kun Kap, Dr. Kanchit, thank you so much. So we'll be expecting also questions on vaccine manufacturing in Thailand later on. Going forward, our next speaker, she's actually one of the more senior in our group. She studied medicine in Leningrad Medical School in Russia and obtained her master's in public health at the Royal Tropical Institute in Amsterdam. And she used to be deputy director of the Department of Preventive Medicine in the Ministry of Health in Vietnam. And after her retirement, she was doing consulting work with WHO, UNICEF, Sweden's SIDA, World Bank, and the ABB. Prior to joining the TA6767 as health security expert for Vietnam, she was part of the ADB-supported health security project. So friends and colleagues, I'd like to present Dr. Nguyen Ting Ho Tu, or as we fondly call her, Dr. Tu. Dr. Tu, it's your turn.
Network quality. Okay. Can you see my screen?
Right.
Thank you very much for
Okay, Dr. Tu, go ahead.
everyone. Yes. And good afternoon. My presentation is COVID-19 epidemic and vaccine situation in Vietnam. Next, please. Next, please. Three content. First is the current situation of COVID-19 in Vietnam and solution and reason of COVID prevention and vaccine strategy. Next. Situation COVID-19 in Vietnam, we have four stages COVID-19. First, from January 2020 to June 2020, we have 15 cases, no death in Bangkok City. And stage 2, June and to January 2021, we have more than 1,000 cases, 35 death cases, and in only one city. And stage 3, we have more than 1,000 cases, but also no death in, also concentrated in one province in Hải Dương. Next, please. Next, please.
Dr. Tu, apologies for disturbing your presentation, but I think we could not hear your words. Could you speak loudly?
Yes. Next, please. Okay.
Thank
And
you.
okay, can you hear? Can you hear louder? And
I think this is better than the one earlier. Thank you.
Okay, we have more than 1,600,000 cases. Can you hear louder? In we have 33 provinces in the city. Okay, people more than 30,000 death cases in 51 provinces in the city. And patient mainly 13 to 49 years, so 31%. Most of death over 50 years, so 84%. But until now is that we have until only in January we have more than 2 million infections, and number death is 37, more than 37,000 cases. But up to now we have already 39,000 death cases. And
Dr. Tu, you still there?
yeah, show next, please. Face. I cannot see. Okay, next, please.
Next slide.
Yes, next place. Yes.
Okay.
Some solution and there's the COVID-19 prevention. No, previous, please. Okay. First, leadership and now next, please.
Okay, there you go. The leadership.
Okay. Leadership and direction. the government direct to implement the UN goal is developing economy, ensuring social security, and being ready for epidemic prevention and control. We have a national steering committee, and this uh, we have changed from October 19. We changed the step adaptation, flexible, effective control to the COVID-19 epidemic. Five key principles plus vaccine plus drug and plus information technology and people awareness. This is our strategy. And we have in the professional and technical activities, we have testing, isolating, testing, treatment, vaccination, research, and applied technology transfer, and other six more solutions. Next, please. And third content is the vaccine strategy. Is the goal of the vaccine strategy is to vaccinate the population free of charge every year to achieve herd immunity throughout the country. The vaccine strategy focus on main content, import technology transfer, research for domestic production and development of vaccine. And Vietnam aims to receive 150 million doses of COVID-19 vaccine in 2021 to immunize about 70% of the population to achieve herd immunity. Next, please. Next, please. Now, previous.
Okay.
We have a license of vaccine. We have 9 vaccine against the COVID-19 have been licensed, and funding resource to buy vaccine and vaccine fund. The total resource of purchase the COVID vaccine has been approved about 1.2 billion US dollar. Up to now, the government and locality have arranged about 19 billion Vietnam dong to buy vaccine. And we have a vaccine fund, total mobile 8,000 8,800 billion. And we have spent this fund and also to support research and testing to vaccine 8.8 billion Vietnam dong. The how to pass the finding a vaccine we have through mechanism is the COVAX mechanism, vaccine diplomacy and research technology transfer vaccine. Next, please. Very important is the vaccine diplomacy. In the first half of 2021, we have one of the country with a very low vaccine to control good disease, and so it's not prioritized for distribution in the world. However, when the first outbreak spread, the consideration on aspect of many of the friends and the partners and the in the world. So here is the many our leader to have diplomacy, talking with high leader with the vaccine. But it is such technology. We have 2 types of vaccine developed by Vietnam is the nanocovax and Covivax. Nanocovax already in the third stage of the clinical trial. Covivax we have moved finish second thing amplified in the processing and packaging in Vietnam, and I think very soon we have this vaccine, and we have 2 vaccine technology transfer We have one vaccine, BBC COVID-19 150 developed by mRNA technology and other vaccine by Japanese company. Next, please. Next, please. Next, please.
Next slide.
Next, please. Next page, please. Next one. Next, please.
Before that.
Next, please. Can you next, please? Can you go to next page, please?
Before that, before.
Can you go to the next, please? Cannot see anything. Next, please. Can you go?
Dr. Tu, this is how to access
Next,
vaccines
please.
for the people.
Can you go another page? Can you go another? I cannot see. I cannot see. Okay. Next, please. Next, please.
Okay.
I cannot see here.
Can you go back to
page.
the conclusion? Before that. Is this the one, Dr. Tu? How to receive and store vaccines?
Next, please.
Next.
Next, please. Next. Can you hear me?
Yeah, we can hear you. We can hear you clear. What's the title of the slide?
Next, please. Next, please. Vaccination reason. I cannot. I cannot see in the screen. In the screen.
Okay. What's the title of your slide there, Dr. Tu, so we can help you out?
Cannot see in the screen, please. Please continue my screen.
What's shown on?
Yeah. Maybe we can reshare the PowerPoint, Sarah, so that yeah.
Okay.
Unshare and then reshare. Maybe Dr. Tu has problems seeing the screen.
Okay, let me reshare.
And then maybe we can Dr. Tu, which slide number are you going to continue on?
Yes. Slide
number 9 or 10?
Number 9. 9. Yes. Okay.
9. Okay.
Yes, 9.
Butos ako sa katulong.
Okay. I continue my presentation.
Okay. Thank you.
It's okay. Here internet very bad, so sometimes it's not connected. Continue how to receive and store vaccine. We have two systems. First is the cold chain system outside the Ministry of Health. The Ministry of Health has granted certificate for 3 cold storage for VNBC immunization system. And outside that, VNBC have used 6 personalized refrigerated trucks to transport vaccine from the airport to the General White House to transport vaccine centers. And the content system of the Ministry of Health. We have cold chain system equipped at more than 11,000 Commonwealth medical stations over 700 districts and 63 provinces. In the past 3 years, the immunization project has provided 3 room to the storage vaccine and many other storage like a refrigerator truck to transfer the vaccine. And also from 2020 to 2021, we approximately received 1,000 refrigerators funded by the Gavi. Now Vietnam has almost enough vaccine as well as provided with a control system to receive sold and distribute to the route for the vaccine. Next, please. Next, please. Can you next, please?
Next slide.
Yeah, next slide, please.
Shara.
Next slide, please.
Randy, after this slide,
How to
its conclusion.
How to access vaccine for the people. We have the COVID vaccine campaign. Okay, conclusion. First, how to 10, please.
10. There you go.
Okay. 10. How to
Slide 10.
Number 10. How to access the vaccine for the people. We have COVID vaccination campaign and also media campaign. And go to conclusion. It's a very bad internet. Very bad internet working. Assessment of the AP situation in Vietnam has been controlled by nationwide, but the epidemic is still complicated with the number of new infections. And now we have every night, every day, we have 40,000 new cases. It's a very, very big number. And also, second one is epidemic prevention and control was implemented promptly and effectively, but most from change the policy, so positive reason. And third, diplomatic strategy has been effective. Vaccine research has made significant progress, and vaccination strategy is very good adopted by the people, and vaccination of about 100% with first doses, 96% third doses, and 22% have third doses. And children now to 7 more than 90% already received the vaccine. Next, please. Next one. Next slide. Next slide, please.
Next slide.
Okay, next slide.
This is the last slide, Dr. Tu.
Okay.
Yeah.
Cannot see.
12.
Cannot see.
12.
Okay. Okay, I just talk about some point of gap and limitation. First is forecasting is sometimes not close to reality. Second, private health system has not been mobilized to participate in the fight against the epidemic. And equity treatment of COVID-19 epidemic prevention and control vehicle lacking of moisture and majority only 77%. Most of medical equipment, drug, biological products, vaccine have to imported, leading to untimely, passive, and high cost. The number of preventive health workers is short in both quantity and quality. Communication work is not well prepared. Timely information is not available. Their time of passiveness and confusing, especially during the early period of epidemic. And last one is application of information technology has very much is internet is not so good, so I cannot present my presentation very well. Okay, thank you very much.
Thank you so much, Dr. Tu. Come on. Yeah, we understand the situation when it comes to virtual meetings like this. So thank you so much.
Okay.
Okay, so now we go to the open forum for questions. Um, let me check the. Okay. Um, Anybody would want to raise their hands and ask for questions? But before that, I just start first? There's a question coming from Foxai. She just left. Foxai is from the Lao Resident Mission. This is directed to Rabia. The question is, what is the investment cost for the Smile program, which would include technology, consulting services, equipment, etc.?
Thank you, Foxai, for the question. I actually cannot get a detail of the investment cost because all the open access for the UNDP is an open tender, so the final budget I cannot see. But from the development trackers that I find from 2019 to 2021, there is 34 national consultant being hired by UNDP for the SMILE application. The UNDP also provide the whole wireless temperature data loggers for the nationwide, and also they provide infrastructure of GPS tracker unit and temperature monitoring for all 514 districts in Indonesia. So yeah, at least that I can say what UNDP has given for the development of the SMILE application for Indonesia from 2018 to 2021.
Okay.
That's all, Randy. Yes, thank you.
Thank you so much, Bia. Any more questions from uh, the participants? How? Check, and can you check me just in case? But I couldn't see from my end. But there's another question here. Gem. Okay. Private sector engagement. What are the key factors, Jeremy? This is the question. What it has been very hard for us to engage the private sector, particularly on health. What are the key factors you think can lure or entice private sector engagement, particularly on COVID-19 management, prevention, and vaccine deployment? So I think the question is, what are the key factors to make private sector engagement more substantive?
Thank you. I think private sector has been very involved in the COVID-19 response in the Philippines. It's also because they wanted to help reopen the economy as early as possible. So it's really just I think having one consortium, one central group is also part of is also one of the key things to to engage with them, because they can just you just contact people, the core members of this group for anything you need, and then they talk together, where they have uh, something they can someone they can tap from their capacity or not. I think that's one. And I mean, if there's anything particular that they're on the area of the response that they're interested in, because they can probably let me know, because so far the engagement with the Philippines is really very interactive with the private sector. So I did not see it in the Philippines that it's hard to engage them in the response.
Okay. Thanks, Jim. And do you have questions from the floor yet? Okay. If there's none yet, there's one for Dr. Kanchit on vaccine. Okay. If Thailand has already been manufacturing its vaccine, why is there a need for Thailand to import more?
The reason is because the vaccine that is under development has not reached licensing yet. So we cannot wait for that chance. It cannot be a chance. And in 2021, we also encounter into the problem with vaccine shortage. It's not totally shortage, but it's semi shortage. It's just like we with that experience, I think the government is now preparing to prepare ourselves with the number of vaccine that is planned to use in 2022.
Okay. And another, Dr. Kanchit, you know that while AstraZeneca is there, not all vaccines being produced in Thailand goes to Thailand, right?
That's correct. It's about 1/3. The other 2/3 is export to other countries.
Okay, so the only 1/3 is retained in Thailand.
That's correct.
Okay. Follow-up question is that what is the status of the other vaccines being tested, developed in Thailand? You mentioned about some other platforms that are currently being developed with the cooperation of the universities. Are they what phase of the testing period are they in now?
I think only 4 that has been presented in the slide that has the possibility to go into the clinical trial. The rest, I think, they drop out or they are not going forward. But however, in terms of vaccine strategy in Thailand, we see that this is a capacity building also. So we right now we can say for sure that we have all platforms of vaccine that is available that can be locally produced.
Okay.
Technology is here.
So thank you, Dr. Kanchit. Other questions I couldn't see from my end? Shek, Sarah, can you help me out? If there are questions, just please flag me if there are questions from the other participants.
So
This is
far, Randy, there's no questions in the chat box.
okay. And now this is for Dr.
โทษนะ
Raymond.
ครับเดี๋ยวกำลังประชุมอยู่
Sir Randy, there's one from
Yeah.
Gideon.
Okay, Gideon. Okay, to all any of the speakers, are there mechanisms in place in your country, agency, institution to consciously learn from or actively document lessons from your experiences? Do you think they are applicable for future health crises? I'd like to repeat the question. To all the speakers, are there mechanisms in place in your country or agency to consciously learn from or actively document lessons from your experiences? Do you think they are applicable for future health crises? Let's start with Rabia.
Randy, I think in terms of the mechanisms in place, there is no centralized mechanism yet about it, but I think what like many actually innovations that have been done now is actually much applicable for future health crisis or even strengthening health system in general. Like the one that I actually mentioned about the smile is actually strengthening the overall national routine immunization program itself. And I think definitely we can use this kind of opportunity to actually strengthening the overall health system and not only focus on COVID and pandemic response itself. So yeah, that's from me, Randy. Thank you.
Okay. So I think the focus of the question is: are there health practice or lessons that we might learn from and use for future pandemic? We go to Dr. Raymond.
Yes, thank you. Thank you for the question. A lot of the gains that we have been able to get during the COVID-19 pandemic really is just preparing the runway, so to speak, with regards to our national implementation of the universal health coverage. The hope is that all of these gains, whether it's through health information systems that's implemented nationally, even though there are fragmented parts of the healthcare system, whether it's the partnership that has blossomed between the private sector and the government sector, whether it's the consolidation in terms of seeking advice from domain experts before arriving at critical decisions, all of these things will really be critical in terms of being able to spur on the successful implementation of universal health coverage. The Philippines is just at its, so to speak, infancy of its implementation, but hopefully through the passage of the law RA 11223 and also the empowerment of the local governments, that's something that we could take with us as we move away from the COVID-19 pandemic.
Okay. I'll get back to you later on, Raymond, for another question about digital vaccine certificate. Now, Jem, some lessons that we can, or documentation of things that could be useful for future health crisis or pandemic?
Yes, I would say definitely for especially with the private sector engagement. This is also one of the things that the private sector has already been doing now. Is actually they're engaging the Boston Consulting to share the best practices around the world, and also the private sector also did a best practices playbook, which were shared with best practices playbook of the country to be shared with everyone in the country. So that has been a document shared. I'm not so sure if it's public, and definitely with ADP, we're looking forward to actually doing one paper or compilation of the best practices that we did for COVID-19 response, especially with the vaccination program.
Okay, thank you, Jem. Actually, we may probably later on conceptualize another discussion, a webinar on private sector engagement, because similar private sector engagement is being done also in Thailand, right, Dr. Kanchit, no?
Yes, thank you for this question. I also would like to respond that in Thailand, I think the government is now, I cannot say for sure for the whole government, but at least for the Department of Disease Control and with the Ministry of Public Health, they are now planning to have a review, like an intra-action review, self-assessment that we have done, and this can be something that we will come up with some good practices and also identify gap. And for your information, the Ministry of Public Health is now inviting and also working with the WHO, trying to have our second joint external evaluation review. I think hopefully if things can go well, I think we may have the next JEE in June this year.
Okay.
So that might be another way to come up with good practices and also weaknesses. So to answer whether we are ready, I think we cannot say for sure, but this kind of review might help us to prepare ourselves better next time. Thank you.
Okay, thank you, Dr. Kanchik. Can you hear from Dr. Tu? There are just some more questions later on. Dr. Tu, can you hear from you? Some lessons, that important lessons that can be shared and will help us later on deal with future pandemics. Dr. Tu probably is having internet connectivity problems. Dr. Tu, you're not there. One, two, Dr. Tu, Dr. Three. No. Okay. So let's hear from Dr. Tu later on. Follow-up question. Dr. Tu, you're
Randy,
there.
yeah.
You're muted, Dr. Tu.
I'm here.
Okay. Nice to see you again.
Okay.
Important lessons, Dr. Tu, which, there are two Dr. Tus.
Yes. Yes.
We need to close the other one so there's no echo. Yeah.
Okay, Dr. Tu.
Yes.
So, are there important lessons, Dr. Tu, that you can is currently being documented so that we can use later on in future pandemics?
Okay. Okay. Okay.
Check. Maybe we can go back to Dr. Tu later on because I still have lots of questions here.
Okay.
Yeah, I think so. There may be some difficulties.
Okay, Dr. Tu, we go back to you later. Okay.
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 Okay. Can you hear me?
Yes, we can, but um, very choppy.
It's because the connection is not so good.
Okay. So we go next to check. Can you mute her first? Okay, we go to Raymond. Raymond, uh, digital
Yes.
vaccine certificate. This is very important, particularly in the Mekong areas for migrant workers and tourists that are inbound and outbound. Um, is there a possibility of realizing mutually recognized digital vaccine certificates for countries that are sending and receiving migrant workers?
Also, yes. So for all of the 49 countries at the very least, it's already in place with regards to the mutual recognition. What will be important to note is for the ASEAN region, only 3 of the 10 countries well, 3 of the 9 because the Philippines will be excluded. 3 of the 9 countries that the Philippines could potentially have entered into a mutual recognition agreement is in place. That doesn't mean that our Ministry of Foreign Affairs or Department of Foreign Affairs has not been able to initiate the conversation. In fact, our DFA has already sent out MRs or memorandum references with regards to initiate the talks with 96, I think, with at least 96 foreign jurisdictions and countries to be able to have the digital vaccination certificate be recognized. In parallel, the Philippine government has also set up a sub-technical working group on VaxCert PH. And what that does is also work with the airlines such as IATA, so that those that will be traveling just based on if the airline is affiliated with IATA, then they could essentially be recognized as well if they show the VaxCert PH digital vaccination certificate. So a lot of different avenues, a lot of parallel work being done just to be able to spur on that mutual recognition. It has been it has been seen as an essential tool, at least for now, in terms of initially opening up the economy. But later on, we will think that it will also be just as useful in comparison to the WHO yellow card or the yellow international certification vaccination. So a lot of moving parts, but hopefully that's something that we could apply in other use cases.
Okay. This is, I think, directed to the project office. Dodo, will TA6767 support initiatives on mutually recognized digital vaccine certificate for receiving and sending countries?
Sorry. Yes. I have to shift to my phone. I also have bad connection. I think the answer is yes. It is part of what the TA will support. So it's so the challenge really, and I think, is that right now a lot of the work is mutual. That's what as what Raymond was saying. It's mutual recognition. So, and at a certain point, you could only, you could just imagine how difficult would those kinds of arrangements are. So, at a certain point, there need to be some, for example, a ASEAN-wide recognition, mutual recognition. So, it says, sorry, I missed the right word. The operative word Raymond was saying, it's bilateral, mutually bilateral. That means they have to talk. The Philippine government has to talk with another government for agreements to be made. While something which is in a sense like ASEAN-wide, or even beyond ASEAN, would be the best way to move forward. And this is a particular area which we can hopefully help in the thinking. The decisions, of course, would be beyond ADB. Some on the these are government decisions, but we will highlight the benefits of having such a regional-wide recognition of vaccine certificates. I think there's a growing recognition that in the post-COVID world, so we're already assuming the good news that the pandemic will end. Requirements of vaccination, requirements of test results would be among the things that countries will probably keep on adopting until the countries will essentially sort of recover. And so there'll be a number of years that we could expect that this will be required, and we need to smoothen our processes. We need to ensure acceptability across many countries, region-wide, because if not, then that will just really create a lot of problems and barriers.
I see. Okay, thank you, Dodo. Just last two more questions. I think for anyone who would want to raise this, who would want to respond to this, is it recommended for all countries to be manufacturing their own respective vaccines?
Allow me to respond to that. Dr. Kenshit will probably answer to that later. But one of the things we've seen with COVID-19, and I think as we listen to the presentation from Thailand, COVID-19 vaccine triggered a lot of investment in vaccine manufacturing. In Vietnam, we are also, of course, hearing that type of acceleration of desires for vaccine manufacturing. Indonesia, of course, we know biopharma is also scaling up. In the Philippines, they're talking about we as a part of ADB, our Office of Public-Private Partnership has actually been supporting the Philippine government explore building up domestic manufacturing capacity using the PPP approach. And if we go out of Southeast Asia, it seems that every country, large enough, particularly large enough countries, are all talking about manufacturing. So we haven't really heard discussions in the region whether shall this be is it every country on its own to manufacture, or and that's why I'm gonna pass it to Dr. Kanchwit. Is there going to be a region-wide mechanism where, for example, a number of countries will be designated as the manufacturer, but with a guarantee and assurance that if something happens, they make sure that they supply the countries that will be, in a sense, non-manufacturing. So I think this will be among the questions that we use that with the TA will try to help facilitate the discussions and hopefully help also provide knowledge and practice and all that, and hopefully help facilitate more pragmatic long-term solutions. Yeah. So Dr. Kanchit may probably can take over.
Dr. Kachit?
Yes, Landy, I'm sorry. Can you repeat the question again? I'm sorry.
Is it recommended for all countries to be manufacturing their own COVID-19 vaccines? So that means not just Thailand or the Philippines, but all countries in Southeast Asia to be manufacturing. Is it wise? Is it good?
Uh, I think my response this time will be personal view based on the situation that happened. I think for COVID-19, I think situation forced country to move ahead without consulting each other very much. And besides, some country may get faster than the other. So real time is the essence in this case. So emergency vaccine may have different approach than the routine vaccine. So for routine vaccine, I think it's not wise to really produce it in too many places. I think vaccine really take time and resources and expertise. And so with that in mind, I think for routine vaccination, the approach is we have to come together and decide on who should be the producer. But for the emergency vaccine like COVID, we really the situation really forces us to really work independently. So that is my personal view. Thank you.
All right, thank you so much. Actually, we're running out of time, but there's just one question. But maybe next time, how do we start living with the pandemic? So, but anyway,
Okay.
I'll have Dodo now doing
Randy,
the closing remarks.
allow me to answer that. Okay.
Okay, Dodo.
I think first we'll answer that what Dr. Kanchit response probably means that in the soon in one of the hopefully before the first year ends, we'll have another webinar, or probably not a webinar, like a debate, which Secure can help convene, where we have the discussion on what's really moving forward with vaccine manufacturing.
Okay.
And not just vaccine manufacturing, even PPE. When you talk about health security, is it a country perspective or is it a region perspective? And we'll get our friends from ASEAN to work with us on this.
Okay.
So let's have that. I think that's a debate, a discussion that needs to happen sooner than later.
No, that is a very good suggestion from you. I think AVSS also maybe another forum that I think ADB, if possible, should be participated.
So we'll do it with the AVSS. So we'll have that discussion offline.
Yes. Okay. Thank you very much. Promise.
And this is what's good about these webinars. I think the second question they're asking about what's going to happen with, and that's a very interesting question, because if we get to listen not just to our respective countries, and even I think when I listen for our friends from WHO and all that, they talk about post-pandemic, right? But how to imagine what life would be, right? Does it mean we wear masks forever? What would be the implications and all that? That's really something that also needs some discussion. Our colleagues from SCRC here in the CERT has been looking into that quite closely. The SEED symposium and all that has been looking into. So as they look probably in a much more broader sense, we'll try to look into more health. One of the things I always tell people is that this virus, this pandemic seems to change so fast, right? It's and so this will be probably things we will also be looking into closely and hopefully give a better answer than giving motherhood statements, which unfortunately at this point is what we can really talk about. That, post-pandemic, wear masks, continue the health protocols and all that. But really, what would life be? There's really, I think, I think we should be looking for better answers. So, Rand, I think, we're closing. So,
Yeah, Dodo, close it.
I'll give it to you. Okay, you can close it.
That may require another webinar to
Another
discuss.
webinar. We're gonna have another webinar. Okay. Okay.
Dodo, you're supposed to do the closing
I'm
remarks.
supposed to do the closing. So first of all, I would like to thank everybody who stayed with us. I don't know how many is still here. Sorry, as I said, I lost my connection, so I have to transfer to my phone. And would like to thank everyone, the team, of course, Randy, Sarah, Sheikh, and everybody, and Mona. I'd like to thank our speakers, Rabia, Raymond, Jeremy, Dr. Kanchit, Dr. Tu. We actually picked a very nice day today. It's a very nice day today. 2022, right?
Yeah.
So well, we're assuming that you're in the Asian time zone. Okay. We were actually thinking of having this on Valentine's Day, but we decided to move it a bit. We think this is a very lucky number. So I think it's a good start. Vaccination Days, Valentine Days. The security is going to be a mechanism, how do we call it? An instrument of CERD, of SHS to help our developing member countries develop and implement COVID-19 vaccination and strengthen their health security. We look forward to supporting the MCs. We look forward for more sharing of knowledge, and we'd like again to thank all the speakers. And everybody who's still with us. So enjoy the rest of the afternoon. Bye bye, everyone.
Yeah. Before we end, I'd like everybody to invite everybody on March for the Women and Vaccines seminar.
Yes, we'll be sending something on that soon. Okay, bye bye.
Bye bye. Thank you so much.
Bye bye. Thank you.
Bye.